Now let's talk about squamous cell. How does it differ from basal cell?
Well, they're very similar. They're actually the same cell, the keratinocyte, or the majority cell in the epidermis, okay? Squamous cell carcinomas are less common, about 10 to 15% of skin cancers, but still that makes up a huge number when you're talking about a base number of 5.5 million, right? So we certainly see them all day, every day, okay? They're more tender, pink, scaly, inflamed, bothersome to people.
How tender?
Can be quite tender, and that's kind of on the fortunate side because people do tend to come in for them earlier. Yeah, they bother people. Exactly. And that seems to be because they elicit more of an immune response. Okay, but of course, you know, some of our biggest hitters in our clinic from skin cancer standpoint are those with a poor immune system, whether they have HIV, CLL, chronic lymphocytic leukemia, or they're on a drug that might suppress their immune system that they take for Crohn's disease or arthritis or one of those sorts of things. Those are very, very, very common in that population. Transplant patients, they get squamous cell carcinoma a lot.
In immunology, we call it tumor surveillance, where the immune system looks for and attacks and gets rid of some.
Right.
But if your immune system is not working, it gives you a greater chance.
Yeah, absolutely.
Is there a scaliness? Is there a roughness to a squamous cell?
And these have a progenitor lesion, meaning that they often come from an actinic keratosis, a precancer. Basal cells seem to come up de novo usually. Some people debate that, but a lot of people think that, you know, squamous cell carcinomas occur in the beginning as an actinic keratosis, which is one of the most common things that we treat, you know, to try to go ahead and get those nipped in the bud and avoid the cancer later. But yeah, the squamous cell carcinoma is very common, and for the most part does not spread internally, okay, at low rate of metastasis, certainly compared to melanoma, which is why, even though it's only 1 to 2% of skin cancers, that's the one that people know the name of. But squamous cells certainly can, and we've learned a lot over the last few years about how to predict which ones might. Okay,
what do you
so
do?
that's important to know.
We've got skin lesions, they're tender, they can be on any location.
Yeah, so you want to watch out particularly well for lesions on the lip.
Wow.
Okay, and that's why we probably don't do a good enough job talking about sunscreening lips, using sunscreen containing lip balm and that sort of thing, because lips are a really worrisome place. So lip, ear, and then this part of the lateral cheek temporal area seem to be higher risk locations. Certainly larger squamous cells, so when they're bigger than a couple of centimeters, which is about a quarter or so, about the size of a quarter or so. And, you know, under the microscope, when a pathologist looks, if he sees that the cells look particularly aggressive, those are worrisome signs.
So if you get a worrisome squamous cell, something that makes you think it will be more aggressive, how do you attack it? How do you treat it? What do you do?
Yeah, that's where we usually involve some help. You know, if it's in one of those locations, then I will often use an ENT head and neck surgeon or a surgical oncologist to be able to examine the lymph nodes in the area very well using MRI and other techniques to see if there might be any metastatic disease in that area. And in the past, that would just be, okay, we excise it, we radiate the area, and that's still important, and I think those things are still standard of care. You know, fortunately now there also is a fancy new drug for metastatic squamous cell carcinoma, so we're so fortunate to have so many brand new cancer drugs recently.
What's its name? Does it go with the hedgehog?
No. This one's called Libtayo or cemiplimab, okay? And it's one of the PD-1 inhibitors, so programmed cell death inhibitors. So it basically, you know, you hate to make a cancer almost personified, but there are ways that cancer cells can kind of sneak around the immune system, even if your immune system's in pretty good shape. Okay, and this unmasks the tumor in lay terms, okay, so that it's more, the immune system is more effective in attacking it, and they can work amazingly well. They tend to trigger kind of autoimmune type side effects, though, that can be problematic. So we're glad to have them, but we certainly would rather not have to get to that point.
Sure.